you so much for inviting me. It's truly a pleasure to be with you today. And my presentation today, I'm going to have a few slides, but I really want it to be interactive. I want to answer your questions. I want to share a little bit about my path in global health, as well as the center where I work. And feel free to ask questions throughout. So I'm going to share screen. I have about 10 slides, and then it'll be really a conversation. So, the presentation is called Health, Human Rights, and Politics in Global Health. And as many of you may think of global health and going into a career of global health, I'm hoping that the talk will expand your sort of imagination of what that means, that it's not simply going into medicine, although when I was your age, I did consider going into medicine, and recognize that there are many, many other paths where you can have an impact in global health, through the law, through human rights, through social work, through organizing, through politics. And, I really want us to talk about that. So my journey. And I've put a few countries with flags in terms of, this is a course of global health. And I wanted to ask any of you if you can put in the chat if you know what the two countries above the US are. I know we have both US and international folks. All right, I'm seeing a lot in the chat. Lebanon and Greece. All right, everybody is catching it. So yes, my story began in basically being raised in Greece. I spent all of my childhood there. I came to the US to go to college. And right after college, I went to Beirut, Lebanon, first to teach in a high school and then worked at the UN. But I would say that my thinking around what global health means has been shaped by being raised in Greece, by spending most of my 20s in Beirut and traveling across the Middle East, but also by being in the US. And I have gone, as Siam mentioned, I spent a lot of my career at the United Nations. I joined the organization in my early 20s, and I stayed there until just a few years ago when I joined Harvard. And in that role, advising governments from across the world. But my understanding of global health is also very local. So I currently live in a small town in Massachusetts, in Brookline, and I am on an advisory council for public health. So I advise the town's public health policy. I serve on our school committee. I serve on our legislature. So really my experiences have been both tremendously, big picture global, but also very local. And I think it's important that when we talk about global health, we don't lose sight of the fact that we are interconnected. Decisions that are made in the US on, say, climate policy have a real impact on the lives and the health of people in the Maldives and vice versa. So really global health can't, you can do global health work through community level work and also UN policy work and all the levels in between. So my journey, as Sam mentioned, brought me recently to politics. And I think this was really an era, COVID-19 has brought public health to a much more political place. But, my entire career at the UN was in some ways political because health is political. Why we have health inequities, why we know that, why is life expectancy different in some parts of the world versus the US? Why do we have child malnutrition in some parts of the world and not in other parts of the world? So there's nothing biological about it. It's all political. So I have become much more active on what I call the political determinants of health. And in 2020, I ran for US Congress here in Massachusetts. And actually, there was another colleague, Dr. Goldstein, who also ran for Congress at that time. Neither of us won. Dr. Goldstein is now the Massachusetts Public Health Commissioner, so he stayed quite involved in politics. And I'm, at the FXB Center, leading a center on health and human rights. But I think that experience, and in the Q&A, I would love to talk to you about that experience, led me to believe that, we're not going to change health outcomes simply by doing good research or treating patients one at a time. That truly the way to advance health and health equity is through political processes, whether it's, really being part of political decision-making or political processes like, being part of the Sunrise Movement and calling for climate action in your local, national, and global levels. So some of you may have heard of the social determinants of health, and this is kind of a landmark report from the World Health Organization, possibly a report that came out before some of you were even born, but it was a landmark report. And it basically said that who gets sick, who dies, and who suffers from the long-term consequences of, socioeconomic consequences because of poverty is rooted in how we structure our societies, our laws, our policies, and our governance mechanisms. You may have heard the term that, our health is shaped by our zip code, or our health is shaped by where people live, grow, love, pray, age, these sort of concepts. And you can talk about that from a global health perspective. Are you lucky enough to be born in a community that has access to clean water and sanitation? Are you born in a community that is facing the existential threat of climate change today because, you are a small island developing state or not? But importantly, the World Health Organization also said that these circumstances are shaped by the distribution of money, of power, of resources at global, national, and local levels. And that's really the work that the FXB Center is focused on, this concept of power and money. And, we are a center that focuses on health and human rights. So some may wonder, where does the law fit in? And there's this framework by a lawyer, Dr. Yerby, who basically says, if the outcome is health and well-being, and we say that the systems that shape that are, our public health system, our healthcare systems, do we have good hospitals, our neighborhoods and our built environment, do we have access to, green space, are our buildings, free of asbestos, our education system, do we have access to the knowledge to build, healthy lives, or even our economic stability, is there widespread poverty and malnutrition? All of these things shape our health. And that's what the social determinants are, the context of the environment outside of the healthcare system. So it's not that your health is shaped by whether or not you have a good primary health doctor, but your health is shaped by the conditions in where you live. But then she takes it a step back and she says, what determines those conditions? And that's where the law comes in. That's where politics come in. That's where budget decisions come in. That's where regulations come in. So if you're living in a country that has no regulations, like no EPA, the Environmental Protection Agency in the US, nothing to ensure that the water is free of toxins and pollutants, then clearly your exposure to toxins will be different from a place that, doesn't allow for them. And the law, she claims, is the tool through which we can either address or not address underlying structural discrimination. And in the United States, that structural discrimination is most often seen vis-a-vis racism. So how structural racism shapes your opportunities for living in a healthy community, working a job that has your protections. But there's also sexism, there's also ableism, and other forms of classism and isms that are playing out across the world. So really, it is discrimination that is foundational to how health and health equity is shaped, and not just our biologies, and that is where the FXB Center really focuses a lot of its work. So who are we? We're a center at Harvard. We were set up by Albina Dubois-Arvray and Jonathan Mann, who was a pioneer 30 years ago in thinking about HIV in the law and saying that the reason why people are exposed to HIV is not only because of their behaviors, but also because of our laws. If you, for example, criminalize same-sex behavior, you're pushing some behaviors underground. If you stigmatize men who have sex with men, you may not be providing them with the tools to protect themselves. So really thinking about the law and the conditions in driving the HIV epidemic across the world. That was kind of the early start. But since then, we've moved to many, many other areas of work. But our mission is still to use interdisciplinary approaches to promote equity and dignity for those oppressed by racism, poverty, stigma. And this work is both in the US and across the world. In fact, until about 5 years ago, the work of the FXB Center for Health and Human Rights at Harvard only was global, in the very traditional word of global, everything outside the US. But when Mary Bassett, our faculty director, joined, she said, we cannot have a center on health and human rights that assumes that that isn't a problem in the United States, and started really focusing on structural racism, mass incarceration, over policing, these sort of real threats to health and human rights in the US as part of the same framework. And I think a big challenge to the global health community is how do we ensure to connect, as I said, the very local experiences in whatever country you are to the global processes, and not to exclude the US as if the US is, not part of the globe. The US is, and a very important part, especially on the policy level around climate and other areas. So, our vision is a world that fulfills the human rights of all people with a special attention to children and protects them from injustices imposed by discrimination, poverty, conflict, and disaster. And we do that work in partnership with governments, with civil society organizations, with members of the international policy community. And, we are at a school of public health, so research is a big part of it, but that's not the only part of it. So our leadership team, just a quick, this is just part of the group. Mary Bassett at the top was the New York City and New York State Health Commissioner. She's a Black doctor who spent 15 years in Zimbabwe before returning to the US to do work at the health departments, really someone who connects the global and the local. The bottom left corner is Professor Jackie Baba, who's a human rights lawyer, who does a lot of work on children and child protection, as well as migration issues. We have Magda Matsake, who is a Roma scholar from Romania, who leads our program on Roma rights in Europe. Roma are the most discriminated group in Europe, including in Greece, where I grew up. Sachit Balsari, who does work in India, as well as more broadly in South Asia, looking at different issues from climate change to the use of technologies and AI. And Vasilia Vigiviki, who does a lot of our refugee work, including a program in Greece this summer. It's actually happening right now. So we have, our areas of work are child protection, structural violence and discrimination, distress migration, and crisis resilience and response. And we have 3 educational programs, one around child protection, one around an intensive summer course on migration and refugee studies, which is happening right now in Greece, and one in Palestine happening right now in the West Bank with the Birzeit University on social medicine, bringing together doctors from the Gaza Strip, doctors, researchers, public health folks from the Gaza Strip, the West Bank, and from Harvard and the US together. The 2 programs at the bottom are happening right now. But let me give you an example of how we think about our role as a center in academia. So our Roma program, as I mentioned, is led by a Roma scholar who is a lecturer at the School of Public Health. Her background was as an activist in Romania for Roma rights. She is herself Roma and has been thinking about how do we connect the dots between research, between the conversations on structural racism in the US to the Roma experience in Europe. And we have, every year she puts on a really impressive global conference. That's the Legacies and Manifestations of Anti-Roma Racism is the one that we had this year. And we had an exhibition on eugenics and that accompanied it. She writes papers, but she also does a lot of community-based participatory research where she is there to facilitate as a researcher, but really the research is being defined and led by the Roma scholars. And that's the kind of model that we'd like to continue. I see Vinay has a question, so I will take the question and then I'll continue. Or was that by accident, a raised hand?
Might have been by accident.
Maybe it was an accident, no problem. Some of the other work, because, as I said, we consider health to be political, is that we don't shy away from political conversations. So right now in the United States, there's a conversation happening around reparations in health. So the FXB Center is asking the question, what would a health lens bring to the conversation of reparations? So there was a book that was put out by some scholars here looking at reparations globally and learning from the reparations efforts globally. But we also had a symposium where we brought together public health experts, medical experts, policymakers, journalists to talk about reparations in the US as a policy conversation. We know people are talking about it, but it's typically historians and economists, but what does the health lens bring to it? An argument that we believe is that actually health helps kind of expose injustice in more more visible ways. So if you, and we have great metrics on health. We, collect data on who is alive, who dies. We know if they died prematurely. So in some ways, health gives us both the data, tools, but also a moral prerogative to push policies that might otherwise be seen as too politically hot. And so the FXB Center is not shying away from these difficult political conversations and bringing in health research and health thinking to those conversations, and hopefully health scholars also. And we do this both, I said at the domestic level, but also at the international level. The World Health Organization and a number of other UN agencies approached us and said, it was early on in the pandemic, and they said, we are seeing that the pandemic is disproportionately impacting people of color, whether in the US, Sweden, in Europe, and also, so how can we think about tackling structural racism and ethnicity-based discrimination in the recovery process and rebuilding from COVID-19? So we did a number of consultations with them and put out this report. Finally, the FXB Center is very proud to be sort of publishing this journal, the Health and Human Rights Journal, that tries to connect the dots on a lot of the issues, creating, this is one piece on global voices for global justice, bringing in practitioners of law, practitioners in public health departments, but also scholars to think about health and human rights collectively. So I'm going to stop there, and I'm going to stop screening. I promise to keep this short so that we can have a conversation. And I see that there are a few questions in the chat. So I'm wondering, okay, so somebody asked me a direct question. They said, can you talk a little bit about your education? How did you get to this level and job? What did you study in college and things like that? So I'm going to start with that. And then I'm going to actually ask you to raise your hands. And if possible, for you to, jump in and speak, because it'll be hard for me to follow the chat, but Siam can also help me. So in terms of an education, when I was your age, when I was in high school, I thought I was going to be a doctor. I grew up in a family, I said, I grew up in Greece and both my parents were doctors, and I was interested in health. And I thought that medicine is really the way to address health. And I came to college and I started in biochemistry. But in the summers, I realized that I didn't want to be in a lab. I actually wanted to be doing work in the field. So I, for example, after my sophomore year, spent the summer in Pakistan, in the northern Kalasha valleys, doing work with a community group on education and other issues. And, I realized that the path to medicine I wasn't willing to do the sort of lab research, and, I didn't quite understand why I had to take physics and biochem and everything. So I switched to social anthropology, and it was, a really, for me, my interest in travel and in learning about different places of the world and languages, it fit well for me. So I switched to social anthropology, and then I moved to Beirut right after college, not sure what my path would be. I actually, for a master's degree, I applied to different programs. I applied to a journalism program. I applied to an NGO management program. I applied to a school of public health. And, I share this to say that I could write my story backwards, but in fact, there were many points in my life that I had to make decisions that at times felt like I was taking them in the wrong direction, but I made choices. And I think, if you can take risks, take those risks. So I don't think that you have to study anthropology or biochemistry in order to have a career like mine. But I think you do need to be a risk taker. You need to travel. You need to want to learn languages to have a career, in the UN and things like that. All right, lots of questions. All right, let's start with Nidhish. And
yeah, hi, Dr. Linos. So you were talking about how you guys, don't shy away from race, and that got me thinking about how, many politicians do decide to stay silent about race. It's often referred to as the race silent narrative. So what effect does that have on reparations, not only in the US for slavery, but globally in terms of racism? Because you also talked about Romania and things like that.
Yeah, no, that's a great question. And of course, it depends on where in the US you are. I'm in Massachusetts, so people in Massachusetts do talk about racism and even reparations. When I ran for Congress, I talked about reparations, which was considered, um, probably not, my team didn't think that was the smartest thing. But in fact, because I brought it into the conversation when we had debates with the other candidates for Congress, people asked, like, what are your views on reparations? And every candidate had to say, I agree with him, because, Massachusetts is quite progressive. So bringing in the conversation, opening the conversation in some places like Massachusetts allows for some progress. But I do think that we are increasingly seeing a very polarized United States with, attacks on critical race theory. I mentioned that I volunteer. I'm on the school board in Brookline, and school boards across the country are banning books on race and racism. So I don't want to underplay your question. We are at a time where even the language, talking about structural racism is difficult, but the FXB Center has chosen to name structural racism, to be investing in research, to showing how that impacts both Black Americans, but also the health and well-being of all Americans, and really to be pushing that research and scholarship in parallel to the political, piece. Jackson, I think you might be next.
Hi. I was wondering about your years going, like, when you were saying you were running for Congress, about your experience, about your experience when you were running, and what you were doing during that.
No, that's a great question, Jackson. And I think, the one thing that I've learned is that it's never too early for people to get politically involved. So I decided to run for Congress early in the pandemic. So it was 2020, April 2020. I was writing, I was at Harvard writing pieces in the New York Times and sort of saying, this is a pandemic. This is really going to hit our country hard because of, structural racism. I was, thinking and kind of calling out, there had been one death in the US, and myself and Mary Bassett really were kind of calling for an equity lens to it. And at some point I decided that, it felt futile to be sort of on the outside or in academia trying to encourage politicians to do better. So I decided to run for office. And, it's a difficult decision, especially if you, the literature shows if you're a woman, if you're a person of color, if you don't come from, real wealth, it's expensive. But it was an amazing experience. So my campaign was very short. It was only 4 months, but I built a team of 400 plus volunteers, many of which were young, high school students, as well as, others. But really running for office is saying, what are your values? What do you stand for? And I stood for having more scientists in Congress, for a more equitable response to COVID, and really saying that, we were about to enter a pandemic, and having epidemiologists at the table and someone like me who had the global health experience would be important. I didn't win, and that, in some ways is disappointing, but I also didn't quit. That for me was the beginning of a political career. So I ran then for our local office, which I was successful in. I have run again, for school committee. I now chair the Environmental League of Massachusetts, which endorses candidates for political office based on their climate policies or environmental policies. So getting political is something that I think all of you can do if you choose to, and you can do it through, community groups, but you can also do it by volunteering on campaigns if you are inspired by a politician. The reality is the politics in the United States is really difficult. It's a lot of money shapes a lot of it. And so, it's not true that there's an equal playing ground, But for candidates who can build a real grassroots volunteer base with lots of volunteers, they can do a lot better, even if they can't raise millions of dollars, which is usually what is spent on campaigns. So Jackson, if you're ever interested in running for office or volunteering on a campaign, I'd encourage you to. I think, but at a minimum, I encourage all of you, once you are able to vote and to be involved in political processes, whether it's directly through voting or indirectly through community groups that create accountability and put pressure on politicians to do better on the issues that they care about. Vinay.
Thank you.
Oh, thanks, Jackson.
Hi. So my question was about how to get involved, because I wanted to do medicine, but politics has always been an interest of mine. I definitely want to get involved in running for office at some point in my career. So how would you recommend I get started in terms of getting experience in how government works so that I can better advocate for policies?
That's a great question. And, my path was not the traditional one. So I started at the global level because I was a UN staff member. So I saw how, heads of states were making decisions and, the global governance architecture. Most people start at the very local level, which means, in your town, in your city, in your community, there are people who are, whether it's a city council or a town form of government, there are people who are running for office who would love for you to be a volunteer on their campaign. There are often open meetings. For example, where I live in Brookline, any decision that is taken, there are volunteer groups that are participating in it, and our political system is quite open. So you can show up for, discussions. You can get involved with community groups that are working on an issue that you care about. So if you care about health inequities, there might be groups that are working in health, with homeless populations. There might be groups working on language access for, say, immigrant communities. There are different groups working on the rights of people that have implications for health. So I don't think there's a clear, one strategy, but do get involved in the sense of, show up to any open meetings. If a candidate you love is running for office, volunteer on their campaign. If there is a group that, so oftentimes for those of us who have thought about doing medicine, our imagination around what to do on the summers, where to intern is really like a hospital system. But what I'm trying to sort of encourage all of you to see is that actually health is shaped by so much else. So it might actually be the food pantry down the street that is doing more for health than your hospital. And that experience might give you insights for the future. So there's no one path. But I think starting to get involved in your community at the community level is great. But because of social media and because of, the way we're connected, you can also be doing global work. For example, the climate movement is led by young people across the world, and they're connecting through social media and platforms so that you can be doing very local, hands-on work, but you could also be part of global conversations. So don't restrict your imagination. But I think most important, don't do it to check a box, but do it because you will meet friends, you will build community, you will start kind of feeling that your work has an impact. Dishita.
Thank you so much for sharing your insight and journey. I really appreciate learning about these different routes into working in global health. Recently, I've kind of been studying how medical practitioners gain exposure and humility to inequities and discrimination. And one method you mentioned was sending health workers on international programs to interact directly with marginalized communities. But I've also come across warnings that it sometimes promotes an attitude of saviorism and can cause more harm than good. So what would be your take on making sure experiences like that are productive and respectful?
That's a fantastic question. And I think the fact that you're asking the question is the way to be approaching it. So for us, for my work, the places that I highlighted, Lebanon, and Greece and the US, I engaged for a very long time, years, not a 1-week trip. There is this risk of kind of tourism of poverty, which is, is really tremendously harmful. our program, for example, in the West Bank that's happening right now is bringing together students. So it's the US-based students, the students from Gaza and the West Bank all together for 3 weeks together. And the idea is that you are building community and you're not there as the American, white savior to go and solve the problems, but that you're co-learning at the same time in sort of, in conversation. So I think the structure of any program that is bringing people is, important. I think language, going to a place that you have some language skills or investing in learning some of those language, the language is important. But I think your concern is actually real. There's a whole conversation in global health around decolonizing global health and making sure that we are elevating voices of people. Are we investing in the capacity building, or are we there to just, kind of put band-aids, bringing in Western sort of notions? So the whole conversation that's happening around decolonizing global health is really, really important. For me, I think a lot of, those kind of concerns made me turn to doing more work at the local level, like in my community. So I worked at the New York City Health Department for a few years, and now I do work in Brookline advising government. So I think part of the solution is to break down this dichotomy of like global health doing work across, in a different country. And anthropology as a field also went through this struggle, because anthropologists in the past were people who, but there was then this movement for anthropology at home. So for example, my senior thesis for college, I did it in Greece, even though I was Greek, so it was kind of like doing a self-reflection of your own community too. So I think an important step is to not imagine that the rest of the world has all these problems and your community doesn't. So really kind of grounding your interest both locally and globally is one way to gain some humility. And then if you are going to be doing international work, really investing the time to learn the language, to repeat, not to be, but I don't think it's bad to, spend a summer somewhere, as long as you're going there to say it's, I'm here to learn, not to change the structure in one summer, because that level of, that's more problematic than it is. But I'm really glad you're asking the question. And I think that's a question that a lot of people in global health and should be asking and are asking. Vasily.
Hello, good afternoon, Dr. Linos. I've decided to join this program because I was always interested in how to solve poverty. Because ever since, because I've grown up in Greece as well, I've seen firsthand the difficulties that poor people have faced. And so I'm keen to ask, are there or have there been any plans by the FXB Center for Health and Human Rights on helping the poor around the world with their access to health?
Yeah, so you're absolutely right. Poverty is the main kind of what the social determinants of health frame talks about is poverty. A lot of it came out of research by Michael Marmot in the UK and other places, showing that on any health outcome, if you create quintiles of like the poorest to the richest, any health outcome, you see a gradient. So you will have better health in terms of diabetes, in terms of cancer, in terms of, across the poverty gradient. And, what we have been doing at the FXB Center during COVID was to support a movement, a grassroots movement led by Reverend Barber in the US called the Poor People's Campaign, which really is trying to elevate the issue of poverty in the US. Poverty actually is another issue that politicians don't like to talk about. They like to talk about the middle class because people, so poverty is kind of an invisible challenge in the US, even though we know that there is true poverty, especially among children. Like among wealthy countries, the US has some of the highest rates of child poverty, but poverty is like something that we don't talk about. So what the FXB Center did during COVID, Reverend Barber, who leads this movement, the Poor People's Campaign, is really trying to elevate the voices of poor people to tell their stories, to advocate for change. But he has said that every movement needs a footnote. So FXB stepped in to be that footnote. Here's the research that is showing, here's some data that you can use, not to be like upfront, but to really be that footnote. So that's at the domestic level. Globally, the issue of poverty is even harsher. We see, countries where there are people living below $1 a day. There is poverty, inequities within countries, rural communities in dire conditions. And, if you're going into global health, how do you think about those issues? And I think it's really saying that, if you're a doctor, you may not be able to change those systems, but you are able to use your voice to advocate for, more attention to inequality and growing inequality. So I don't have an answer to you other than to say that poverty is central. The work that FXB does around racism, it's important to also say that is how structural racism and how discrimination works. So, for example, in Greece, Roma communities are living in dire poverty, and that's because we discriminate against that group of people. So they're forced into, sort of unstable housing. And similarly, so discrimination is part of the poverty conversation. It's not by chance that some people live in poverty and some don't. It's not because they're not working hard. It's because our systems are built in a way that we have allowed for systemic discrimination, both in the US, in parts of, in countries where there's a caste system. It's ingrained in our institutions. So I think it's questioning those institutions, not putting the blame on the poor themselves, and then elevating those voices is one way forward. And doctors and healthcare professionals have a lot to say and to do. And, at the very short term, before we can do the policy change, there are ways that doctors, for example, in the US, you can prescribe, if your patient is pretty sick, that they don't cut off electricity. So you can prescribe in Massachusetts that your electricity will be paid even if you can't pay for it. And that's really important in the summer when there's a heat wave, so that you can have an air conditioning if you own an air conditioning, or in the winter for the heat to not be cut off. So really thinking about what your role is in even the short term, I think, is important. And I know we have lots of hands, so I'll go to Maya.
Hi, Dr. Linos. Good afternoon. I wanted to ask, one of my biggest interests is refugees, and I know that FXB works with them. So what is one way that you think high schoolers could get involved in helping solve the refugee crisis, even though we live in the USA?
That's a great question, Maya. And there are many different ways that you can get involved. The US does receive refugees, a smaller number than we should be, but your community probably has, civil society groups working with resettled Afghan refugees, people from Syria, people from Ukraine right now. So there are ways you can volunteer for direct services with those groups. There are also ways that you can be engaged in policy. Immigration policy is different from kind of refugee and asylum policy, but at times they're interconnected. I think one of the challenges is that increasingly we're going to see more, for example, climate migrants, and we don't have language for that because refugees are crossing borders because of war and the fear that they will be persecuted because of their identity. That's kind of the definition of a refugee. And with the climate crisis, it's not because of your identity, it's because you live in these conditions. So I think into the future, there is going to have to be real conversations around who is a refugee, what responsibility do wealthy kind of countries like the US have towards the harm, because we know that the climate crisis wasn't caused by the poorest countries in the world. In fact, it is the consumption patterns, the emissions of countries like the US and China and a few other countries too, such high rates of emissions that we have caused, a crisis that is being borne out and really felt by the poorest countries. So if people are losing their access to livelihoods, or droughts are causing them to have to flee, and then we don't open up our borders, like where's the responsibility? So I think into the future, those are the conversations. And I think, I bring it up because I think a lot of young people are involved in the climate conversations, as I said. So you can bring in the refugee angle that way too, through kind of policy, through lifting up voices. But at the very local level, I'm sure there are services and ways that you can get involved too. But it's sadly only going to get more difficult for people to be able to thrive on this planet. Arkan.
Yeah, thank you, Dr. Linos. I really enjoyed listening to your presentation. So one question I do have is, you talked about a certain Roma program, right? So I was just wondering that, can like people like our age participate in it, or like can we set up a chapter of it in schools and or schools or other places, and how do we do so?
That's a great question, Arkan. So our program mostly focuses on, our work as a university. We do work at the with graduate students. But if you are interested, do reach out. I think my email, is available on the FXB website. You can find it or reach out through this program, and we can think about it. I haven't thought about, the Roma people are really mostly excluded in Europe. There are Roma communities in the US, and depending on where you are, there may be larger ones or smaller ones. So I'd be interested in continuing this conversation. I should say a time check. I had said I would stay till 12:45, but I see there's a lot of questions, so I will stay till 1. But if you need to drop off, feel free to drop off. And I'm going to take questions like 2 at a time, and I'll be briefer just so that we can get through to them. Danielle.
Hi, my name is Danielle. I am a rising senior at MOT Charter in Delaware, located in the USA. So I had a question on your point about racial gaps, especially with events such as the Tuskegee syphilis study and with Henrietta Lacks too. So how do we work toward repairing the relationship between the Black community and the healthcare field?
I mean, that's a fantastic question. And I think, in the United States, that is one of the most, and I said I was going to take 2 at a time, but I will take this one on its own because it deserves its own answer. The history of medical experimentation, the history of abuses, of ethics, of unethical behavior is one that we can't ignore. So one, I think at a minimum, is to train doctors of that history so that they know about it. The second is to create, ways to not repeat it. And then because at FXB we care about reparations, is to repair that harm through institutional changes. I mean, I think work that needs to happen includes, and I'm ensuring that we have enough doctors of colors and administrators of color in hospitals, making sure that our community investments are really thoughtful. During COVID, a lot of people were saying, oh, people are not being vaccinated because they're hesitant because of the history. And to some extent, there's some that could have been part of it, but we also did not make sure that we had access. Like we didn't make an effort to bring vaccines into communities most impacted. So questions of access and ethics also have to come hand in hand. And for those of you working in global health, it's important to realize that this history isn't unique to the US. There have been histories of women across the world being, forced sterilization of women because of disability or ethnic status. So learning the history of wherever you're working of these human rights abuses is critical, and being able to commit to not doing it again. Pranavi.
Hi, Dr. Linos. Thank you so much for this very informative presentation. So I just had a question that you were saying about your career and like your education in college. And you said that you wanted to be like a doctor in like medical field, but then you changed your mind. So could you just go into a little bit more detail about like what you ended up like studying and stuff?
Okay, real quick. So I thought I was going to be a doctor. I changed my mind. I did do biochemistry the first 2 years of college. So I did all my pre-med requirements. But then when I did social anthropology, it was much more cultural anthropology, that type of work. And I realized that I didn't want to treat patients one at a time, but think about policies and systems. So then I did a master's degree in public health, and then a doctoral degree, a PhD in social epidemiology, which is the field of epidemiology that really looks at these social factors. And then, I worked at the UN and really was at the very high level of the policy work. But, I could be doing the work I'm doing now with a law degree. I could be doing the work I'm doing now with a sociology degree. I could be doing this work with government or international relations, as long as I also had some public health, basic knowledge. So what I'm trying to say is expand your imagination, history of science, and history is so important to a lot of these issues, is also an area. So don't be prescriptive. Mihaela and Anupama, I will take the two of you.
Yes, hello. So I'm also interested into learning more about the Roma program. So I'm from Bulgaria, which, as you know, is next to Greece. And in Bulgaria, as you probably also know, Roma people is like, they're very stigmatized, even within themselves. It's a really big issue. And I'm really surprised that even in the US, this is getting attention, and especially in Harvard, because specifically in Bulgaria, we never even learn about this issue even getting attention. And I was going to ask, are you really influencing policy specifically in Bulgaria, for example? And are there like, is it like on an international level? Like,
Yeah. Quick answer, and feel free to reach out, is that we are doing work with the EU. So our director, Magda Matake, because she's from Romania, she also travels to Bulgaria. We work with the Central European University that does have a big Roma program. We are trying to shape policy. Again, researchers as much as they can, but by providing the data and the evidence at the European level. But you're absolutely right. In a lot of these countries, the Roma are considered so stigmatized that people don't even consider how terrible, our policies are towards them. So trying to elevate the Roma sort of plight and the violence, that happens both literally and in terms of policies. And I think by bringing it to Harvard and by talking about it at Harvard, you have kind of the Harvard name when you go to the European Union and the European Commission and saying, we're watching, we're part of it. So using that privilege, but I can't say that our program alone is going to change things, but we're hoping to be part of the solution. Anupama.
Hi, Dr. Linos. It's been an honor to hear from you today. My question is, how do we combat politically polarized influence in policymaking? I feel like a lot of the time people don't actually agree with certain policies, but it's more of because of like political herd behavior. How can we engage people to think more critically? And because I've noticed that a lot of the time, human rights now has become largely politicized.
That's a great question. I'll take one from Trishita and I'll come back to both of you.
Hi, Dr. Linos. Thank you for sharing your journey with us today. You talked a lot about your experience running for Congress, but I was wondering if you could talk about your role as a social epidemiologist in the UN and during your time there.
Great. So to the first question around polarized language, I think it's a critical question, and I don't necessarily have the answer other than to say that we are training our scientists and our researchers in communication skills, because I think one is knowing your audience and when to use what language, like really being, able to sort of shift your conversation to be heard, not because you're trying to placate people, but really to be heard. I read somewhere that, the daughters of conservative, kind of right-wing folks are the most influential when it comes to climate policy, speaking to their parents. So, oftentimes also knowing who is the messenger for those of you who go into global health, your white coat, if you're a physician or a nurse, that, gives you a level of credibility. But there's a debate even in health and saying like, maybe we're becoming too political, like maybe we should stay neutral in order to be able to. So I don't have an answer. The way I've been addressing it is to not shy away from values, being very clear that, fundamentally, I believe that people should be treated equal, that they should have the right to live a healthy life, that they should not be dying because of discrimination. But sometimes, you might not want to use the words that are so politically triggering for others, but I'm still trying to work through that. And Trishita, to your question about being a social epidemiologist at the UN. So it was interesting. I spent a lot of my career at the UN Development Program. So if you're in global health, you probably have heard of the World Health Organization. And in fact, a lot of the work that the UN Development Program did was around everything outside of healthcare. The World Health Organization worked with, physicians and hospitals, but the development program was doing things like gender equality, poverty alleviation, climate change. And so as a social epidemiologist, I felt that that development and the framing around the laws and, for non-communicable diseases, issues around advertising of, say, alcohol and tobacco in poor countries, because that's what the tobacco industry was doing. These were the ways that a social epidemiologist could work. But it's interesting because then people were like, wait, why are you, why aren't you at the World Health Organization? But again, this is where I encourage you to expand your view of health to include kind of the broader, that you can be doing important health work if you're working on public transportation, for example. Vihan and Lee.
Hello, Dr. Linos. Thank you for your presentation. And in your talk, you explained how the FXB is working against the different detriments of health. And I was wondering, based on your experience, would you say that working locally with specific communities or working on a more global level with global politics has more of an actual lasting impact?
That's a good question. Let me take it before I go to Lee. So I actually think you need both, right? And it's not one is better than the other. At the global level, you may be making very minor changes. So UN resolutions, for example, every year it's the same resolution, maybe a word changes, something like that. But when there's breakthrough, like the Paris Agreement, or when, Beijing, which was a Beijing +20 was the important sort of gender equality, like breakthroughs at the global level can have a huge impact. But oftentimes it's marginal and you sort of have to wait. And at the policy level, at the community level, you might be able to see the change immediately, and so it really, and then at the individual level, if you're a physician, you can also see it immediately. So I actually think you need to be acting at all those levels. And it's really where you yourself find your passion and your excitement, what motivates you. So I've been happy to do work across levels and to switch back and forth. So, doing UN work while also talking about the tree that is going to be planted in my neighborhood and the location through my local work, like that actually matters to me. So I like having kind of impact at both levels. Lee.
Hi, I'm Leah from Massachusetts. Thanks for your presentation today. I was wondering if you could talk a bit more about your early education efforts in Northern Pakistan and college and how they helped guide your journey into health, human rights, and politics.
So, I think it would be an overstatement to say that it guided things. What I did enjoy, so I was in the Kalasha valleys of Pakistan. It's, a tribal region. I think it was an amazing experience to spend a summer, but as somebody said, it's more the personal growth, the understanding of that I'm interested in learning about other places. At that point, I thought I was going to be an anthropologist and that was part of it. But, I saw some of the inequities, no access to running water, the housing conditions, but I can't say that it was actually what was more instrumental was I returned right before 9/11. I was there the summer right before, and I had met a lot of Afghan refugees in Pakistan, and then realizing that the war, 9/11 was going to mean many more Afghan refugees going into Pakistan. So I actually got quite involved in efforts in the US to support communities in Pakistan and the Red Crescent there to receive refugees. So I think that was the most impactful thing. Like having been there, I was very alert to, how the US kind of, how interconnected we were and how refugee flows. But, I'm grateful that I was a guest in, the Kalasha Valleys, but I can't say, it's not one thing that shapes your career. It's kind of an accumulation. And we are so running out of time and people are adding their names. So Shri, right, I want everybody to get a chance to speak. So I'm going to ask you all to speak and then I'll conclude by trying to capture everything. So Shri, Raya, we'll go down the five of you and 1, 2, 3, 4, 5, 6, 7 now hands. Okay, they've been adding. Go ahead, Shri.
Hi, thank you for your discourse. So as a fellow advocate or someone who stands with targeted minority groups and rural communities, I've always noticed that minority in indigenous neighborhoods have been forever exploited in the sense that governments have placed landfills, power plants, and such establishments in those areas. And so my question to you is, what is the UN's or the FBX's stance on the exploitation of minority and low-income communities for the placement of environmentally hazardous facilities? Are there any specific policies or initiatives in place to address this issue?
I mean, we do work on environmental justice, and that's kind of the framing through which I'm actually teaching a course on that. But you're absolutely right. Those are issues that we need to address, and the environmental justice movement is basically where those conversations are happening. I am so running out of time. Somebody asked if I could give resources to ask questions. I can put my email in the chat. The problem is I am about to leave on an international trip, and I'll be off email for a bit. I'll be teaching a course, somebody put in the chat, I'll be teaching a course on environmental justice, climate action, and health, but it's for graduate students. Raya, and sorry, Shri, you were absolutely right to raise it, and now I feel like I'm not giving anybody a real good answer because of the time. Raya, Rithik, Pavani, Sydney, Warren, Sierra, I'm going to ask you all to speak, and then I'll conclude, and I will go on mute so I don't feel tempted to answer your questions.
Hi, it's been so great listening to you talk. I've learned a lot. So I actually spent every summer in the Middle East, in Jordan and Palestine. I'm currently in Palestine right now. And I've spent every summer here for my entire life. And I've gotten the chance to work in the hospital environment as well as refugee and orphanage areas in both of these countries, which are considered third world countries. And in that time, I feel like, sorry, it's a packed house, so someone interrupted. But so in that time, I've been able to see what you talked about, where there's no black and white, where the US has all the strengths and all these countries have the weaknesses. There are truly strengths and weaknesses in all systems, both in the US and here. So if not economic reasons, what can be the reasons for these pros and cons to the healthcare systems as well as the charitable systems in these countries?
And Rithik, you can go ahead next.
All right. First of all, I just want to say thank you so much for speaking. And then I also heard you say that the US was not taking in as many refugees as they should have been. So my question to you is, do you think European countries and the US used to take in a larger amount of refugees from Africa and the Middle East would be worried about taking in new refugees after what had occurred in France?
Thanks for your question. We'll go to Pavani next, and she'll answer all of these at the end for Ryan, Rithik.
Hi, thank you, Dr. Linos, for spending your time today with us. I just wanted to ask, so I have interest in artificial intelligence in the medical field, and you talked about inequities in different countries, especially third world countries. And I was wondering if you think there's a possibility for artificial intelligence to be used to promote efficiency in healthcare field, but also provide opportunities in third world countries that can't afford it.
Thanks, Pavani. Next, we'll go to Sydney from Oregon.
Hi, Dr. Linos. So I was wondering that if you could do it all again, would you have pursued a political career earlier, or do you think the experiences in biochemistry really helped you with your career?
Thanks, Sydney. Next, we have Warren from California.
Hi, Dr. Linos. Thanks for talking to us. My question is kind of like hers. So earlier you mentioned you grew up in a family of doctors, and so I was wondering if you faced any pressure going to this field, or if you had any regret about going into global health instead of medicine.
Thanks, Warren. And last we have Sierra.
Hi, so thank you so much for your presentation. So I was just wondering, so during college, what exactly, just brief overview of how you kind of got into the profession that you're in currently. I missed a part of your presentation, unfortunately, so that's my question. Thank you.
Thank you all so much, and thanks, Siam, for moderating. So, I mean, on the question of refugees and political, I think fear is what often is used to kind of allow for policies that I think are discriminatory. So I think the fear of what has happened, what could happen, the potential is something we need to all work against. We should not, allow fear to prevent us from having just, equitable policies. And I think, what explains why different countries, whether it's Palestine or the US, have better healthcare systems. There's an entire literature around, the influence of economic policies, long-term economic policies, including places like the World Bank and, disinvestments in institutions. There's, the impact of colonialism. Like, you can take so many courses, and that's why I think history and history of science is really important for anyone going into global health to think about it. My personal, there were a few questions about my personal path. Would I have chosen a political career earlier if I had regrets about not going into medicine? Again, I think it has been pretty freeing to imagine that, at every juncture, you make a choice. And it's difficult at that point in time. But I feel really happy with the decisions I've made. Something I didn't talk about is, I have 3 young children, and, the work-life balance. A lot of the decisions that I made, when I left the UN, for example, it was because I couldn't travel as much with 3 young children, or I didn't want to travel as much. So you will make decisions both for personal reasons, where you want to live, who you want to be part of. But early on, as a high school student, really, if you're able to think about expanding, opening doors, that is what I encourage you to do. So do I regret did I feel some pressure from my physician doctor parents? Yes, and I'm one of 5 kids. One became a doctor, so they succeeded in one. The rest of us did not. But I did feel some pressure because that's all they could share with me. And any of you who are immigrant, come from immigrant families, the hope is that your child will be successful, and oftentimes that's viewed as a doctor, lawyer, kind of these very more narrow views. So my parents, also had those kind of narrow views. And when I said I'm going to do anthropology, I don't think they really were really happy about that. In retrospect, they will say they supported me, but I don't think they really did. There's a level of luck. There's a level of community that you build along the path. And I want to close with sort of saying that your peer networks, whether it's through this program, your schools, your colleges, are the ones that are really going to help you move forward in life. So build those relationships, building relationships at the community level with, civil society groups and other organizations that you care about. And really, if you want to do work in global health, there are so many paths to make an impact. And I really encourage you to go down that path, because it is an important one. Health and health equity are central to what makes our society worth it. So thank you all for staying on for some extra time. It was a delight speaking to you, and thank you again for the invitation to join you today.